another session of our scientific forum, We Talk to You. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through one of its platform, Puberty to Menopause. These sessions feature leading experts from across the country who share their valuable insights on key health topics, aim to raise awareness and promote overall well-being of society at large. Today, we are delighted to have Dr. Nivedita Ashrit, MBBS, MS, Obstetrics and Gynecology, renowned laparoscopy and infertility specialist. Currently, ma'am is practicing as a consultant doctor in Srishti Women's Clinic, Tarnaka, Secunderabad. Ma'am is with us to share her expert perspective on menstrual health and hygiene for adolescents and inculcating knowledge and confidence. Before we start today's session, please allow me to share a brief introduction of Human Biological Institute. Thank you, ma'am. Thank you so much for joining us today in
Good
our.
morning. Thank you for having me.
Yes, ma'am. Ma'am, like as I mentioned, like today's topic is menstrual health and hygiene for adolescents, that is inculcating knowledge and confidence. So let us begin today's session with some commonly asked questions on this topic. Ma'am, my first question is, at what age do girls start menstruating and what signs should parents watch for?
Normally, most of the girls, like we see in our day to day practice, and even according to literature, most of the girls start menstruating anywhere between 9 to 13 years of age. What we need to understand is this first point where menstruation starts is called as menarche. Now, this is a part of a process called puberty. Now, what is puberty? Puberty is a transition phase. To put it in simple words, it is a transition wherein a girl or a boy basically transits from childhood into adulthood.
Yes.
So this is a process that normally takes 2 to 3 years with lots of changes. There are physical changes, there are biological changes, there are emotional changes, there are psychological changes that involves this period called puberty. And menarche, that is the onset of menstrual cycles, is a part of it that comes toward the end of this phase. Now, this phase of puberty, there is a sequence of events that happen, uh, which are the signs that we should be looking out for. Now, what is the sequence of events is there's first is thelarchy, then adrenarchy, then there is a peak growth spurt, then there is menarche, that is onset of menstruation, and then the egg release starts, that is ovulation. To put it in simpler terms, this whole sequence of events, the first that I said is thelarchy. It is the beginning of breast development. This is the first thing that happens, which is one of the signs that we can look out for, the parents or the girl can be aware of. Usually, menarche, that is the first menstruation, starts on an average interval of, say, 2 years after the onset of breast development. The second is adrenarche, wherein because of the hormonal change, the adolescent girl would develop an oily skin, acne, there is a growth of pubic and axillary hair, and these are the other changes that one can look out for. The third is, of course, there's a growth spurt that goes on for 1 year. There's a sudden increase in the height of the girl, and the body contour also changes. Then that all these precede the beginning of the menses. So these are the signs that a parent or the girl or our healthcare providers can look out for.
Thank you so much, ma'am. Thank you so much for explaining the puberty stages and the growth spurts so clearly, and what are the signs to be seen by the parents to understand more about the puberty. Ma'am, my next question is, ma'am, like when the girl gets a menstrual cycle or gets a periods, what is a normal menstrual cycle length for the teenagers?
Okay. Now, for the a normal menstrual cycle length is 28 days, and the bleeding typically lasts for 3 to 5 days. But having said that, not all women get at exactly 28 days. There is an up and down period of 3 to 5 days, which is acceptable. Now, coming specifically to teenagers. Now, 1 year after menarche, the periods are known to be irregular. So, we needn't get, especially the parents, needn't get alarmed by the fact that the periods are very irregular in the first 1 year. It is known to happen, and it isn't something abnormal.
Okay.
Okay. Now, in the period for a teenage girl, after 1 year of the onset of menses, say between 1 to 3 years, the cycle length can vary from 21 to 45 days.
Okay.
So, a period cycle length less than 21 years, 21 days, sorry, needs to be evaluated, or a cycle more than 45 days also can be concerning. But
Okay.
there is a wide variation, especially for the first 3 years after menarche.
Okay. Ma'am, thank you for saying this, the upper and the lower limit days for the menstrual cycle, so that our viewer parents will be knowing, less and more is also to be known. Thank you, ma'am. Our next question is, what are the common menstrual problems that adolescents experience? They have this concern, they have this fear and all about the menstruation in the adolescent age. So what are the common problems when the adolescent teenagers come to you, to your clinic for the questions, ma'am?
Like I said, most of them are unaware that in the first 1 to 1.5 years, the periods are going to be irregular. So the period irregularity becomes a major cause of concern for these young girls.
Yes.
So that is nothing to worry about. It needs more of reassurance as long as she's not bleeding excessively. So period irregularity is one problem, a perceived problem that many people come to us with. The second is, of course, overbleeding. Pubertal menorrhagia is what we say. Excess and heavy bleeding is a real problem, and we should be aware. The parents, especially, need to be aware that when the girl is bleeding excessively, losing more blood, having prolonged bleeding more than 8 to 10 days, or getting very frequent cycles, once in 15 days, then she definitely needs professional help. Then, of course, there are problems of period pain, dysmenorrhea, which usually is not seen in the beginning 1 to 1.5 years because there is no ovulation. Once the
Yes.
ovulation, that is egg release, starts, that is when the pain starts, and that is of concern to many of the girls. And uh, most of the time, it can be managed without medication, sometimes with medication. So these are the few problems that they usually approach us with. Other than period problems, of course, they may be having mood swings and acne and other issues also, and they do
Yes.
approach with these issues also.
Okay, ma'am. Like, ma'am, the good thing you mentioned about the mood swings, like this teenagers, adolescents joke themselves about the PMS. Like, how serious is the PMS and premenstrual symptoms? Like, how serious and how should we get a treatment for that?
Okay. Now, PMS is something that it varies from person to person. It is a very individual thing depending on so many other factors. Your level of physical activity, your attitude towards your periods, and your perception of the period pain, all these together, and of course, the hormonal changes, which are anyway there for everyone. So, and as part of your teenage growing up years, there are so many things happening, and there is the stress of education during high school. All these may add on to the mood swings also. Most of the time, they can be managed with a little change in the lifestyle, a little good nutrition and diet, and especially physical activity, extracurricular activities, pursuing your hobbies. Such things do matter a lot, and they help a lot in alleviating PMS. And if it reaches a stage where all this is not helping, or it is causing major disruption in the day to day activities, then we give in medication.
Yes, thank you, ma'am. Thank you, because like this is very important, because not only teens or something, the PMS, every
Woman
woman in
faces
every
that. Yes,
stage, they see this. So thank you
yes.
for saying this, ma'am. Ma'am, my next question is, like, as you mentioned, the physical activity is very much important for the woman. So like, how much, the people, they like the parents think that the child shouldn't exercise during the menstrual. So how true is this, ma'am? Is it a true or a fact? It's a myth or a fact?
It is definitely a myth. Physical activity at any stage in life is very good, and especially for teenagers. In fact, there are guidelines that they should be in the having good physical aerobic activity for at least 1 hour per day, in the form of sports or dance or whatever, yoga, whatever they enjoy, whatever they are comfortable with. There is really no reason to restrict physical activity during periods. A person can exercise, continue with the routine day-to-day activities, can indulge in the sports whatever she is doing. Many girls learn dance, they can continue with that also. And one of it will not cause any problem. In fact, it will be helpful in relieving the period pain because it builds up the muscle strength. And also, stretching causes relaxation. General exercise releases lot of endorphins, which happy hormones that help in pain relief. So
Yes.
that also helps in that way. So restricting physical activity is really not needed during periods.
Yes, ma'am. Very well said. And orphans are very much important for everyone to make them happy. So that's the easy way to make yourself happy is to exercise. Thank you
Yes.
for mentioning this, ma'am. Ma'am, what are the market has a commercial, so many commercial products for the menstrual hygiene. So what is your recommendation, ma'am? Like if the child or the woman wants to buy a menstrual products, so what they have to go for it?
See, off late there are lots of menstrual products available. The most common and the most popular still remains the sanitary pads.
Yes.
Most women do prefer that. And since we are actually talking about young girls, adolescents, just in the beginning phase of their periods, I would recommend sanitary pads. There are lots of varieties. I think it is a very individualized thing. What the girl is comfortable with, we should give her that. Okay.
Yes.
And there are other products available like tampons and menstrual cups, which the older girls can use. It may be a little messy and difficult for a young child to use that, but for older girls and women, that is definitely an option. What is most important is the menstrual hygiene. Whether you're using pads or any other product, you need to use it very hygienically, especially in this age group. When we are educating the girl about which pad to use and how to use it, we also need to tell them that you need to change it every 6 hours, especially towards the end of a period cycle, fourth day, fifth day, when the flow is less. Girls don't tend to do that, and that would lead to infections. So every 6 hours a pad has to be changed. They can choose any pad which is comfortable for them, which suits their skin, and anything which is. And for girls who are into sports, they may need some other products like more absorbent pads and maybe tampons for older girls, but
Yes.
according to their comfort level they can choose.
Thank you, ma'am. Thank you for saying this, ma'am. We have another question that, like, usually menstrual hygiene, this young girls and women get obsessed with the vaginal washes and all. Ma'am, is it compulsory that vaginal wash should be used by everyone?
No, no, it's not at all needed. See, the vaginal mucosa naturally has its own mechanism of maintaining a pH.
Yes.
So ideally, vaginal deodorants and scented washes and all needn't be used. It is enough to clean the area properly and change pads every 6 hours.
Okay.
So that is what is more important.
Okay, ma'am. Thank you for mentioning this, ma'am. Ma'am, our next question is like, what advice do you give parents to their daughters understand the menstruation? This is a social media world. Like everything they see in the social media, and they understand very differently. And this puberty to menopause is our initiative that the public should understand in a scientific way, and the parents in the older generation used to have so many myths, so they continue this generation also. So how will you say to the parents like how to update themselves?
Yeah, like you said, there is such a huge barrage of information that we get from social media. So that is where the role of parents becomes very important. What I would suggest is don't avoid questions. When a young kid comes up and asks you, why are you buying a pad or what is this used for? Use it as a clue to educate the kid.
Yes.
It can start as early as maybe, see, the age of menarche is decreasing. The earlier generation, it used to be 12, 13 years. Now we see girls as young as 11 years. So when an 8-year-old or a 7-year-old comes and asks, don't avoid the questions. Take it and answer it so that they understand it at their
Yes.
level. What is
Yes.
important is you have to explain it in simple scientific terms. You have to tell the kid that this is a natural process. There are certain things happening in the body. There are certain organs that start secreting certain hormones starting from the brain and ovaries, where the certain hormones are produced that will cause this, where your body starts showing some changes, and then this is something, something like a period starts, and this is a normal process that happens in every woman. So this kind of education with a scientific and physiological approach, explaining the physiology behind the menstrual cycle becomes very important. So I think parents role comes there. And the second is, especially the older generation, you need to create an environment in the house where period talk is comfortable for the girl. She should be able to approach you, talk openly, have discussions without any embarrassment regarding her concerns regarding the period. The
Yes.
third, of course, as we all know, teenage, preteens, the mood swings, the parents have to give in a lot of emotional support to the girl. uh, and the fourth would be access to the menstrual products that she finds comfortable. That is
Yes.
also a very important thing, and educating about the product and menstrual hygiene, and also the correct way of disposing the product.
Yes.
That also becomes very important. Uh, like you said, the children observe us and learn. Right.
Yes.
So the mother, the sisters, the grandmother, they all have to lead by example. You have
Yes.
to develop a very positive attitude towards the period. It should not be approached or talked about with a sense of apprehension, with a sense of fear or a sense of embarrassment. You have
Yes.
to normalize the whole thing. You have to tell the girl that if this is what happens, this is normal, this is how it's going to be, and this is going to be a part of your life for the next, till you're 45, 50 years of age. So you have to normalize the whole thing, and
Yes.
that becomes very important role
Mm.
for the parents.
Yes, very, very, very well said, ma'am. Like you said, you have to carry it from the, from 13 to endless or years of later
Yes,
on.
yes.
So it's very well said, ma'am.
Yeah.
Ma'am, my next question is like, ma'am, what advice you give the parents for the frequent consultations with the gynecologist? That is very important. Like how frequently when they start getting menstruation, when should they visit you?
See, if the periods are normal, the girl is having a good growth, there are no concerns, and everything is normal, there is really no need to take professional help. But there are
Okay.
certain situations where you need to approach up and take professional help. One is when the period pain becomes very disruptive. See, most of the time, home remedies, physical activity, heat pads, all this you can manage, or over the counter mefenamic acid, all these help. But if it reaches a stage where this is not helping, then we need to rule out other conditions like, ovarian cysts, endometriosis, and certain other medical conditions. So that is where you need to meet a doctor. The second, of course, is I have said many times now in this thing that period irregularity is a known fact. But having said that, prolonged periods, periods lasting for more than 8 to 10 days, very frequent changing of soaking of pad, and where the girl is losing blood excessively and that is causing issues, then definitely they need to meet a healthcare provider. And most of the time these two are the major issues,
Okay, ma'am. Thank you. Ma'am, like usually in puberty.
one small doubt that many people ask, okay, what is,
Yes.
when you ask what is the average age, there's also something called a delayed puberty. So when you don't notice secondary sexual characters in a girl, like breast development and the body changes and the oily skin and all that, before 14 years of age,
Okay.
the period doesn't start by 16 years of age, that is also a cause of concern, and that is when you have to meet a gynecologist.
Consulted out. Okay, ma'am. Thank you. Ma'am, you mentioned that there's a body changes, secondary sexual characters. The main concern for a girl is acne. So, what should they do? Like when there's a very like large severe acne or mild acne, the girls get very tensed about the acne. So, how will be they'll be dealing with that?
See, acne again, it is a basically dermatological problem that gets aggravated here because of the oily skin and the surge of hormones that happens. You need to understand that it's a temporary phase. And
Okay.
if the acne is very superficial, then some small antibiotic cream maintaining good skin hygiene by washing your face regularly, not using very harsh products. All this usually sorts the problem out. But again, some girls develop deep seated acne that may lead to scar formation. That is when they need to consult a dermatologist and take medication for that.
Thank you, ma'am. Thank you. Thank you, ma'am. My last question is today's take home message for our viewers, ma'am.
Today's take home message is that, like I said, we need the entire society, as we as healthcare providers, and very importantly the parents at home and the teachers at school, all of us together have to create an environment where the girl develops a very positive attitude towards her periods. We need to normalize it, and we need to make an environment where the girl is comfortable to approach us with her problems. There is no need to restrict her physical activity. There is definitely no need to isolate her in any way. You have to normalize the whole thing, and that itself is a very big help, other than, of course, taking care of her nutritional needs at that point of time.
Thank you so much, ma'am. I really enjoyed interviewing today. Thank you for giving so much information to our viewers on menstrual health, hygiene, and hygiene for adolescents, and inculcating knowledge and confidence in them. And I really thank you, ma'am.
Thank you, Dr. Shravani. And I would also like to take this opportunity to thank Human Biologicals Limited for having me here and making me a part of this program. Thank you.
Thank you, ma'am. Thank you for all being part of We Talk to You. We hope today's session was informative and valuable in spreading awareness on menstrual health and hygiene for adolescents, in cultivating knowledge and confidence. Our special thanks to Dr. Nivedita Ashrit for having us and giving us a time, expertise, and insights for us today. For those who would like to revisit the program, the video will be available on social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word, as many as including your friends, family, and relatives. Until we meet in our next live talk, stay healthy and stay aware, and please take good care of yourself. Thank you.
Thank you.
Thank you, ma'am.
Thank you.